Welcome back to Dateline New Haven on WNHH-FM, New Haven's home for community radio. I'm Paul Bass, inviting you to look behind the headlines on the stories that make our community tick. Well, we have someone in the studio today for decades has been making New Haven tick and Connecticut tick in such important ways, and she's reaching a milestone. Her name is Frances Padilla. She's Executive Director, is that the right title? President of Universal Healthcare Foundation of Connecticut. She's been there 18 years. And she's stepping down at the end of the month. This is her last month at the helm. I'm sure there are going to be more good things to come. And she's in the studio to tell us what's happened, what she's learned from the process, and what's next. Frances, thank you so much for coming in.
So happy to be here. Thanks for inviting me.
I always feel good when I talk to you. I feel like there are good people in the world, and they're getting stuff done. Universal Healthcare Foundation's name says it all. I think you were formed in 2004?
We actually were formed in 2000.
2000.
Out of the fight...
over the demutualization of a health insurance company.
Exactly.
Was it Anthem?
It was Anthem when it bought up Blue Cross Blue Shield, the last nonprofit health plan we had in Connecticut. And that took place during the 90s, and then when...
And if you wouldn't mind getting the microphone closer to you, Frances?
Sure, no
problem.
problem.
Just move it towards you. Yeah.
There you go.
So, yeah, the last nonprofit health insurance was going. And if I remember correctly, the government got involved in regulations, say, if we're going to let you do this greedy thing that's going to screw up everybody's health care, you're going to at least have to donate money to a foundation whose purpose is to try to get as many people covered with health care as possible, as affordably as possible. Is that the right way to put it?
Well, the actual story is that there had to be some push on the government to make that happen. Because, Connecticut is the insurance capital of the country, and certainly was.
Which never meant insuring people. It meant have insurance companies make a lot of money.
It meant having headquarters in Connecticut, right? And I want to say something, that today is a particularly special day, because this afternoon there is a celebration of life for a man named Phil Wheeler. Phil
UAW.
Yes, he was the leader of the UAW region office for many years, and it was he and a number of other leaders in the labor movement and other people in the community who saw what was happening with the merger between Anthem and Blue Cross, and Phil said, wait a minute, that can't happen. That really can't be allowed to happen without getting something that could be a resource to keep fighting for access to affordable, equitable, quality health care for
everyone. And how
everyone.
much money did they have to put aside to form it?
It was a settlement, and the original settlement was about $40 million. And but it had to go to court. It wasn't something that the insurance company
it was very similar
did.
to another fight at the time of the demutualization of New Haven's last mutual savings bank.
Correct.
And there was a fight. They brought in the government, pushed the government, and they formed a community bank, which is now New Haven Bank.
Exactly right. And this is
those are two great fights of the turn of the century.
They were tremendous.
And unions
fights.
were involved in both. You mentioned Phil Wheeler and UAW. He particularly, and that union, seemed at that time, Frances, if I remember correctly, were involved in so many social issues fights and political issues fights that weren't just about contracts. They really saw healthcare and environment, I believe, as part of what was going to keep their memberships healthy.
Exactly right. And they really saw the fight for universal health care as a social justice fight. And when the foundation was founded and formally created, the mission situated access to affordable, quality, equitable health care in a larger social justice fight. And 22 years later, we continue, and we're leaning even more heavily into the part of that mission that's about social justice. Because as you know, all of the issues that are determined, that social and economic issues determine and affect health. And although we are focused on healthcare is only 20% of what people need to be healthy. The other 80% is affordable quality housing, good education, good jobs with good wages.
Food insecurity, as you know,
Food.
Up to half people in some of our neighborhoods miss some
right.
meals because there's enough food.
Absolutely.
Which is kind of crazy given how much food there is in our
How
state.
much waste there is, right? How much food waste.
So what has that meant for healthcare organizations like yours if you found yourself more involved in like food insecurity, policy discussions, legislation, housing, affordable housing quests?
Absolutely. We have been moving, always in solidarity with social justice issues related to health, but really moving more in a very intentional way to working on building grassroots power to advocate for policy change across the social justice continuum. And really, all roads lead back to health. We are still focused on healthcare policy, of course, but we need power to affect healthcare policy because there's a lot of forces that really consider, change threatening, whether it's the insurance companies or the hospital systems or the pharmaceutical companies. But Connecticut residents, we just completed a household survey this year. Connecticut residents are so worried about affordability. And they're
Across the board.
across the board, across political affiliations, race, ethnicity, income. People are worried about affordability, and particularly prescription drug affordability. And yet, in all these years of advocating for changes that would regulate the industry, changes that would, in the end, benefit consumers, we feel that what is most difficult, most challenging, is that the people are ahead of policymakers. There are some fantastic policymakers. There really are some fantastic people in the legislature who really want to do, they have vision. The powers that be really have a lot more money that they invest in lobbying against that kind of vision. And so it's really about the people. It has to come back to those most directly impacted. And I will say that what we've also, over these 22 years, been able to sharpen for ourselves is an appreciation that if universal health care does not work for Black and brown people, low-income people, LGBTQ, if it doesn't work for disabled and chronically ill people, then it doesn't work for anybody.
And Babs Rose says, I'm a huge fangirl of the fabulous Frances. That's Frances Padilla. This is her final month as president of the Universal Healthcare Foundation, which is behind so much of the progress we've made in this state to get more people covered healthcare more affordably and in concert of what's emerging larger social justice agenda. So when I always seen that you've broken down your work at the foundation as legislation, organizing, and education. So tell me a little bit how you got on that. You came to the foundation 18 years ago. You were named the top person 4 years later. But you had already been involved in foundations. You worked at the Hartford Foundation, Public Giving. You had the Community Foundation for Greater New Haven. You've run your own business. So you knew what the foundation world was like. What made you think you wanted to go to a healthcare foundation to make that change as opposed to a union, an organizing campaign, a insurance company, a healthcare facility? Why foundation work?
Well, I will tell you that, I feel blessed by being able to spend my career in the field of philanthropy, and I've had many opportunities to exercise my voice, and I've taken the opportunity to say some hard things because I feel like philanthropy has a lot of unrealized potential.
Yeah, I was going to ask about that. A lot of times money gets spent. Does it create the change?
Yeah, it's about whether you're committed to the root cause of problems really being addressed. And I'm not, I appreciate that different kinds of foundations have different mandates and different constraints. The field, though, and I'll just speak to my own experience, right? When we fund service programs that are addressing disparities that get created by inequity, we help a lot of people. That's really not in question. And people need help in the here and now, right? The thing is that we could be funding those kinds of programs to help people forever and not actually address why they are having those challenges. You mentioned food insecurity. Another group that we are at Universal really working closely is the immigrant community, and particularly the undocumented.
And you guys are early on that. You guys were the first ones out of the box. On
You
that
know,
one.
it's not really about being first, but it's what we've learned is when the people most impacted are actually in front and they're saying, this is what we need, and we want to work to get it, and come along with us, be co-conspirators with us, that's even more
And I
than
remember
being
that
an
early on.
ally.
I remember some of the early meetings you had on that. I'm thinking 06, 07. Francis, could you give me a few examples of healthcare that is more accessible, affordable now, change they've made in policy because of work your organization has done in concert with allies?
Sure. I'm going to continue this example on the immigrant front because
It's made me think of
it's
it.
been a long time and it has not been an easy journey. The last 2 years have been a turning point. And I will say that our role has been to be shoulder to shoulder with immigrant-led organizations and other partners in making the demand for access to the Husky program for all immigrants regardless of status.
And has that happened?
It has. It's begun to happen. We're getting incremental wins, which, back in the beginning of the foundation's life, we thought incremental wins were not what we were about.
Oh, that's interesting.
No, we wanted it all fast.
I remember that, Ella.
There was a strong sense of urgency, and you asked me before
we also
what
believed
drew
back
me to
then.
that.
Yeah.
And what drew me to healthcare philanthropy, what drew me was this particular foundation's sense of urgency. And I was impressed because I'd felt, even back then in 2004 when I joined the foundation, that philanthropy was a little too complacent, right? Okay to make grants for service programs to make life better for people, but let's, stay away from advocacy and let's stay away from, and what I found with Universal was, no, we're going to start with advocacy. And so that work was really appealing to me, that intersection of public policy and philanthropy.
So what happened that you were hoping to accomplish, and what did you get instead that changed your mind, Francis, about incremental change?
Well, you may recall the campaign to achieve a state law called Sustanet.
I remember Sustanet.
And that was a few years of research where we put a lot of money into getting some good estimates of what it would cost to cover everybody in the state. We've also looked at different models of how to do it. And we came up with what you could call the first, major
option.
public option in
Which
the
means that
country.
you have a choice between a government provider and maybe not you, but maybe you. A lot of us felt like we'd really like to have single payer, but it's not going to happen. So let's have a choice where you can have either, so nobody gets left behind.
Well, we were very focused on leveraging the purchasing and negotiating power of the state of Connecticut. And I still believe that is necessary. I really do believe that's
So what
necessary.
happened with Sustanet?
Well, with Sustanet, what happened was that at the end of the day, the lobbying effort of the insurance companies won. And the power of the people was not enough.
So where did you go? How did you regroup from that?
Well, we also had, if you recall, the timing was such that we had a president named Barack Obama.
Yeah.
And he came out of the door immediately in his administration saying, we're going to get coverage for all of these 50 million uninsured people. And the Affordable Care Act happened too. So we were pushing for Sustanet at the same time that we were pushing for the Affordable Care Act because we knew we needed both. There was a lot of resistance in Connecticut among policymakers because they were being lobbied, one, and two, they were being told, oh, we don't need a state public option. We've got that. But we did need it because today we know that even though a lot more people are covered, and we advocated for that, Connecticut has a lot more people covered today than it did in 2010.
So what are some of the numbers?
There's probably about 200,000 people that, and I'm not sure how recent these numbers are, but about 200,000 people on and off who have been able to buy individual insurance on the exchange. which is in Connecticut, it's known as Access Health CT.
Which was considered the best exchange in the country. It was the first one to have computers working when all the other ones were crashing. Was that because of the work you had done on Sustanet?
Well, we readied the territory, yes, but and I will say that Connecticut, I give credit where credit is due. Connecticut has a lot of people experienced in insurance, and we were able to set up an exchange that actually drew on that as an asset. However, it wasn't set up with enough consumer input, and it still doesn't work well enough. There are still not enough products. We have a real challenge. There's still not enough products on the exchange or even in the private market off the exchange that are affordable to individuals and affordable to small businesses.
So what was the difference between Sustanet, the program you were pushing, and Access Health? Is that a public access? Access Health includes a public auction, right?
No, Access Health is the exchange. It is the organization.
And the exchange doesn't include it.
It does not have a public option.
Oh, okay, so you're still pushing for a public option.
Well, we are. What we have come to recognize, though, is that the public option does not actually help everyone that needs help, right? It helps small businesses, and it would be necessary for small businesses, but it doesn't help across the board. And what we've become more attuned to, Paul, is really doing an equity impact analysis, understanding that there are different groups with differing needs, and matching policy up to what people in those different groups actually need.
Would that be an example? I'm ignorant of this. Would that be an example, for instance, the people who earn just about too much to get Medicaid? We've expanded Medicaid, and would you take credit for that too? As something you guys fought for?
We've been in solidarity on that issue, and I mentioned the Husky for Immigrants campaign, but in terms of expanding Medicaid under the ACA, we were all about that.
And then now, when you talk about groups doesn't work for, are there people who just still earn a little bit too much for Medicaid? We still got to focus on.
Totally. There are still people that need to be focused on. Because they are in that space where they don't qualify for the
exchange.
For the exchange subsidies, the subsidies that come from the federal government, even though two things have happened, and the pandemic actually stimulated this through the American Recovery Act. There has been more money brought into Connecticut and other states that's helping people on the exchange. And then our government here created a Covering Connecticut initiative to actually target that population of people that are in that margin of not being able to afford private insurance on their own and earning a little bit too much to be able to be in the Medicaid
And you're so right
program.
about small business. So the independent nonprofit, small business.
Us too.
And we had such an interesting, my only involvement with the exchange, I met like 2 years ago, the head of the exchange. And he said, oh, you guys can get like cheaper health insurance through us because we get it on the private market. So I said, oh, that's good because we cover people, right? And so I spent hours with this person. In the end, you know what he told me? Everything has come back with, I was going to have less good health insurance, less coverage. I said, well, no, the bottom line is people need good coverage. So I want a plan that costs less than the private market has, because we qualified. It didn't exist. He said you can't get around. If you want to pay less, you're going to have to give lower quality care. And I guess that was always one of the hidden questions, right?
This is the thing. This is why we have always hinged our mission on affordable,
and
accessible, quality, and equitable. Those four, they are connected at the hip because it's possible to buy a bronze plan, pay less, have a lower deductible.
Yeah, that screws
and
the person
then
working.
it does nothing for you. It's insurance, having a card without actual insurance.
Talking to Francis Padilla, who probably knows more from working in the trenches for the last 18 years on what's going on with the quest for affordable and equitable and access to health care in Connecticut as she finishes up a great term as the head of the Universal Healthcare Foundation. How does your thinking evolve on single payer? So, that's where the government is. People like me, it's like an article of faith, right? It's part of my religion. right? Like if I'm saying prayers in the morning, I'm also saying like, of course, because I don't understand why we need health insurance company. Their business model is to not give you what you need, but make as much money as possible for you as they can, and then make it miserable when you try to get the help you need. Why should there be profit in this? They don't do it more efficiently. They do it worse than any bureaucracy you could ever imagine. Mm-hmm. So single payer, we look at other countries, yes, there are problems with it, different models, but like Canada, no one's going to trade it like for private companies. But we can't get there. So Vermont, they listened to the Francis Padillas in Vermont, and they passed single payer health care, but then they had to bag it because there wasn't enough scale. There weren't enough people, and they couldn't make it work affordably.
It also was going to cost too much.
That's what I mean.
Here's the problem, right? The cost for Vermont, that particular instance, was going to equal, it was just too much to be sustained.
Oh, is that because they were too small a group to negotiate a low enough price per head?
Population, right? And the really what we need is a system of national health care. And that is where you ask, where have we come? Mm-hmm. It is really about a federal response to that. We need a system of national health care. The Affordable Care Act ended up being a compromise between the government and the insurance companies, and at that time also the hospital and medical association. Mm-hmm. If you remember a few years back during the presidential campaign, there was a lot of discussion about Medicare for all. And there were about 6 different approaches to Medicare for all. Exactly. So we already have a single payer program in our federal government.
But it doesn't cover everybody.
It doesn't cover everyone. You have to be a certain age, or if you're disabled, right?
So is it fair to say you're pushing for incremental change in Connecticut while you're also looking for the big national policy?
Absolutely. Must have the big national policy. And I want to say something about Medicare for all, because one of the trends that needs to be watched out for is this Medicare Advantage trend.
Where you pay a little more to get decent care.
To get better coverage or better quality benefits. But Paul, this is really privatizing Medicare.
And inequitable.
Inequitable,
means
for
people,
sure.
It's going to be better care for wealthier people, which is the exact opposite idea of a national.
Right. And so the advocacy work, I was I moderated a webinar yesterday that was fascinating, and it was focused on immigrant coverage. But this applies beyond immigrant coverage. There has to be state-level advocacy work that is led by grassroots as well as grass tops advocates together, led by the people most affected. And there has to be sufficient concentration of that work and wins at the state levels to then apply upward pressure simultaneously to the Congress. And that has to be concerted. Like, that's not going to happen by serendipity. It's got to be a strategy. And there are some national organizations that are seeing, so there's the National Immigrant Law Center, for example, is carrying out this kind of a strategy around immigrant coverage. There's a lot to learn from what they're doing.
Prince P, you've learned a lot in over 30 years of foundation work, the last 18 years, Universal Healthcare Foundation. Before I let you go, you're retiring. Are you?
Rewiring.
Tell me about that. What does it mean that you're rewiring?
It means that there obviously are things I am really passionate about. And I really see, 42 years actually, to be exact, Paul. I started in 1981 working for the Hartford Foundation.
Wow.
And I see that, we must have civic engagement. We've got to get more people actively involved in the political process and in the policy process. So what's your role?
Are you going to be, because you already do all this stuff that you don't get paid for. You did Progressive Latino Fund that you've done Boys and Girls, the Women and Girls Fund. Mm-hmm. Are you going to retire from paid work and do all your civic work, or are you looking for another paid career?
I'm open to both. I really am. I really find this is a wonderful place to be where I have some choices. I am open to both.
And you've made such a difference, Francis, for 42 years, and I know you're going to continue to make a difference.
Thank you, Paul.
Thank you for the work you've done. Thanks for keeping one of our core issues on the front burner when some people felt it got a little too hot to touch.
And the work continues. Thank you for all you do, too.
All right, we're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It Would Feel to Be Free from the group CD A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night at WNHH, New Haven's home for community radio.